Hey everybody, and today we're going to be talking about how to block the side effects and the issues that come along with eating sugars, breads, and alcohol. And so make sure that you stay to the end of this video, and I'm going to show you where you can get a free resource in order to do this. Like, it's all done for you. So I'll give you a template, you'll have a grocery list, you'll have meal plans, you'll have everything laid out for you in a step-by-step guide to show you how you can take your health to the next level, or if you're struggling with any type of health issues, just a simple diet that you can use in order to recover your health and get right back on track. So make sure that if you haven't already, please like and subscribe to the channel. It just helps my channel grow, and my mission is to help as many people as possible overcome their chronic health conditions so that they can have the highest quality of life as possible. Now, when you like and share this video, it's going to help me achieve that mission. So thank you very much for those who like and subscribe to the channel and then share it with any of your family or friends. And this can be an interesting topic to kind of discuss with anybody in your family that may have diabetes, insulin resistance, PCOS, or if they're doing high amounts of sugar, or if they're craving sugar all the time, or if they're really struggling. So now let's get into the topic for today. So now there's an interesting fact, and the American Heart Association still think it's okay for people to consume high amounts of sugar, even with heart disease being the #1 killer of people in the US. Now, is it just me, or does anyone else feel like they're taking crazy pills? And then they actually say that it's normal for men to consume 9 tablespoons of sugar, and then women 6 tablespoons of sugar, and have their carb intake at 65% of their caloric intake. Now, apparently the companies promoting these products are really into the AHA's pockets, and so they're helping drive and lobby for these types of food recommendations or the food chart, whatever it is. Now, the problem with this, and if you want a deeper dive into nutrition or health advice or diet advice, I can make another video explaining what diets you should be doing depending on your physical and activity level. So there are different ways that you want a higher carbohydrate diet, a lower carbohydrate diet, and then just the factors that go along with that and the health implications that go along with it too. But I digress. Let's get into the topic for today. So what happens when you eat sugars? And what happens is it spikes your insulin. Now, insulin is what's responsible for type 2 diabetes and type 1 diabetes, insulin resistance, blood sugar issues. Now, insulin is necessary in order to get energy into the cells, but when we abuse it and when we're eating too many high carbohydrates, simple sugars, then a lot of the times it will spike the insulin, which will lead to the downregulation of insulin receptors on the cells. And that doesn't allow us to get energy into the cells, and that can lead to these chronic fatigue type syndromes. Now, you can use a glycemic index to see what foods spike your insulin the most. We want foods that are low on this, but we also want to be aware of foods that are high in the glycemic load or the amount of sugar that's in those. Now, with this being said, eating fiber when you eat sugar can help curb the insulin response. So if you're eating a high sugary meal, if it has a lot of fiber in it, then that will actually plane out and actually decrease the amount of insulin resistance or insulin response that you get. So that is one way that you can combat that, is eating high fiber, taking a fiber supplement or something like that will really help curb that insulin response. Now, when you eat refined sugar, you're going to deplete certain vitamins and minerals, especially vitamin B1 and potassium, because these help burn sugar. So if you're consuming large amounts of sugar with your meals, then a lot of the times what's going to happen is it's really going to deplete these B1 vitamins and then also your potassium. So with that being said, B1 is very essential for neurotransmitters. It's also essential for nerve conduction. So if you're having any type of like fibromyalgia or chronic pain syndrome, a lot of the times you need to look at your sugar intake and see if you're just depleting all of your B1 minerals or vitamins. And then the decrease in potassium can cause increases in heart rate. So you need certain electrolytes in order to have like the electrical conduction in your heart. And a lot of the times if you're eating a large amount of sugar and you have a high elevated heart rate, then a lot of the times that can be an issue. If you have a lot of sugar going through your bloodstream, it will actually damage your eyes, kidney, arteries, and nervous system, just kind of like we talked about before. And sugar causes oxidation, just like rust on a car causes damage to your body tissues. So basically, if you're eating large amounts of sugar, you're basically rusting from the inside out. And that's why it hurts to move, why you have joint pain, and why you just don't feel like you have any energy whatsoever. Now, if you have diabetes or sugar issues, you can add benfotamine or alpha lipoic acid to help combat the oxidative stress of sugar. So, if you're going to eat a lot of these sugars, if you're going to stick to a high carbohydrate meal, especially if you're a high performance athlete, then what you can do is you can offset that with those two supplements, so the benfotamine and the alpha lipoic acid. Other ways to combat high sugar levels is exercise, and that will actually use the glucose and the sugars as energy, so they'll go into the muscle tissue instead of getting stored as fat later on. So one, it will help decrease the amount of fat storage you get, but it will also be readily used as energy, and then that can decrease blood sugar levels. So I recommend that after you eat, just go on like a little light walk, kind of get the blood going and get any of those excess sugars that you may have consumed into the bloodstream and into the muscle tissue immediately. Other things that you can use are apple cider vinegar can actually help in lowering blood sugar. So there are supplements out there. You can also take shots of it before your meals. I would recommend that you dilute it with water, but when you drink it, but that can help in any type of like heartburn, GERD, any type of digestive issues. Cinnamon is also great. It can actually help with the blood sugar response. And then the one thing that I like the most is berberine, and it's almost comparable to metformin in order to regulate blood sugar and without the symptoms. So it's a really cool supplement that they've come out with in the last couple of years that can really help regulate those blood sugars, but it can also help with killing off any type of bacteria, any like gut dysbiosis, leaky gut. It can help with all of that as well. I use that one very commonly in people that I work with. Now, the insulin index is also interesting because it tells us about our body's response to foods when we eat sugar. So you can use the insulin index to kind of see what is happening in your blood sugars when you eat certain foods. Now, the more fat and protein you have combined, the lower the insulin index. So that's why keto works so well for diabetics and people with blood sugar issues, is because along with fiber, high protein and high fat will actually curb that insulin response and actually keep your blood sugar levels more stable. Now, whey protein powder is very bad for your insulin response. It will actually cause a huge increase. Now, it's not so bad if you're eating like this with like a fatty acid, or if you're taking a fiber supplement with your whey protein, but that's something if you, especially if you're trying to build muscle, or if you're somebody who's going to the gym and you think that you need whey protein, it might actually be causing more damage than good. So the more fat, the better the insulin response to buffer the insulin spike. So you can eat eggs in the morning with the yolk. You can do like bacon, you can do ham. Any of those fattier foods will actually help curb that insulin spike. Another thing that you can do is fasting can help you counter the damage caused by high sugar intake. So what I do is I do intermittent fasting maybe 1 or 2 days a week. Any more than that, and I just don't feel that great, especially because I'm a little bit more active. And then I usually try to do like a 24-hour fast at least once a month, and that just kind of helps reset my body and helps clean out any toxins that may be in my body. And a fun fact is that the brain will actually choose ketones over sugar to function, because sugar is very inflammatory to the brain. And when we see like Alzheimer's or dementia or any type of cognitive issues, a lot of the times it's because high sugar levels and high cortisol levels. So actually going on like a ketogenic diet can actually help that. Now, diving into the next part is how do we counter alcohol? And when you ingest alcohol, your liver produces an enzyme to break down the alcohol, and this enzyme is very toxic, and this is what causes you to feel so bad after we drink. So it's not necessarily the alcohol, it's the enzyme that we're using to break down the alcohol. And ways to combat this are you can take vitamin B1 to counter this, and that can actually help you get over the hangover faster because it will help the breakdown of that enzyme. So that's kind of a little cool trick. Other things are pickle juice is great. So if you like pickles, then that can be very beneficial. Water, obviously, staying hydrated. Milk thistle, Pedialyte, any type of electrolyte solution can help. But milk thistle in particular reduces the amount of damage done to the liver. Now, countering drugs. If you take medications, they will cause toxicity to the liver, and you want to be careful about taking milk thistle because this can place too much stress on the liver. Now, typically, metformin depletes vitamin B12 and B1. So, if you're taking metformin and then you're also just still continuing to eat high amounts of sugar, the likelihood of you getting a B1 deficiency is pretty real. Studies show that statins will deplete CoQ10, so that's a very important enzyme for heart health, so you want to be careful with that. Antibiotics kill off good bacteria and can cause yeast infections, so go back and watch my video about candida, especially if you're craving sugar, because if you've been on prolonged antibiotics, then you could have SIBO, gut dysbiosis, something like that going on that could be at the underlying cause of your health concerns. Now, antacids inhibit stomach acid, so you can try apple cider vinegar or betaine HCl if you're having heartburn, GERD, or another kind of like digestive tract issue, especially breaking down. Food materials. Grains will actually lock trace minerals and they can cause vitamin deficiencies. So you have to be careful about consuming too much grain, especially whole grains. So you don't want that to be a major constituent of your diet. Now, the best things to eat are organ meats, shellfish, and be careful because these foods can be high in mercury. And then selenium can bind to mercury and help reduce mercury toxicity. So if you may think that you have like a heavy metal toxicity or something like that, or heavy metal toxicity signs, and then that is something that you can look at adding in. One thing that I can do is I can send you a heavy metal questionnaire. If you think that you have that, just message or put it in the comments below. I'll reach out to you and we'll get that questionnaire for you so you can take that and see. Now, sodium and MSG, you want to take potassium to counteract those because you have that sodium potassium pump that really works with the cells, especially staying hydrated. So taking potassium can help with that. And then eating too much food. So using apple cider vinegar or betaine HCl to help with digestion, especially if you're going to eat a heavy meal and you know that you're going to eat a heavy meal, you want to try to counteract that by helping aid the digestive tract because our bodies need help sometimes, especially if we're doing things that may not be the best and can actually be sort of abusive to our bodies. Now, the last point on this is the keto diet. You want to make sure that you supplement with a good multivitamin to ensure that you're getting all the nutrients you need because there are some vitamins and minerals that you don't necessarily get on the keto diet. So you have to be really careful about your nutrient balance and your vitamin balance when going on the keto, but there are some really good benefits to it. Now, consuming high amounts of carbohydrates, sugar, and alcohol can lead to some of the most prevalent conditions that affect us today. Now, this can look like heart disease, diabetes, insulin resistance, and even cancer. And the point is to reduce as much of these in our diets as possible to address the root cause of these diseases. What we've learned in this video is that through adding fats to our diet and fiber, you can actually reduce the insulin response. So we can actually biohack our bodies in this way, which is really cool. Now, if you haven't already, please be sure to like and subscribe if you found this video helpful. It helps me reach more people to give this important message to the masses. So share this with your loved ones who may be struggling with their health, and let's help them create a strong life. So remember to check out my free resources below, and if you have any questions, please just comment below. My mission is to help as many people as possible. So thank you so much, and I'll see y'all next time. Bye.